Bene, buon pomeriggio a tutti intanto e permettetemi di ringraziarvi per essere presenti a questo incontro che abbiamo organizzato oggi. Come sapete, il focus dell'incontro oggi sarà relativo al complesso respiratorio suino e in particolare al ruolo che 3 patogeni come il Mycoplasma hyopneumoniae, il virus dell'influenza suina e anche il virus del circovirus, appunto, hanno nei confronti di questa forma patologica di questa sindrome che colpisce appunto i suini. Mi permetto anche di ringraziare il professor Maes, il professor Matteo e il dottor Craici che sono nostri ospiti oggi, unitamente a tutto lo staff che ci sta supportando nell'organizzazione di questo evento. La struttura dell'incontro è piuttosto semplice. Avremo le presentazioni del professor Maes e del professor Matteo, successivamente la presentazione del dottor Craici, che concluderanno la fase vera e propria appunto degli speakers, dopodiché saranno seguite da un spazio dedicato alle domande e alle risposte e successivamente a un breve intervento della collega Emanuela Pileri di Seva. Detto questo, quindi, io passo innanzitutto a presentarvi il professor Maes, ammesso che il professore abbia bisogno di questa presentazione, visto che è molto conosciuto da tutti. Sapete perfettamente che ha una carriera estremamente importante dal punto di vista accademico nell'ambito della patologia suina e che è attualmente professore ordinario appunto per Porcine Health Management alla Facoltà di Medicina Veterinaria di Ghent e come sue principali aree di ricerca le patologie infettive, in particolare quelle respiratorie, tra queste il Mycoplasma hyopneumoniae è sicuramente uno degli aspetti più, nei quali ha più approfondito i suoi lavori, ma si è interessato ovviamente anche di Brachyspira, Pierce e Salmonella. È autore di numerosissime pubblicazioni a livello nazionale ed internazionale e direi che è ben conosciuto anche dal nostro ambiente. Per cui, senza togliere troppo spazio appunto alle presentazioni, a questo punto lascio la parola al professor Maes con il primo dei 3 interventi di oggi ed auguro a voi buon ascolto e buona visione. E vi ringrazio. Dominik, the floor is yours.
Good afternoon, everybody. Can you hear me?
Yes, perfectly.
Thank you,
Yes.
Thank you, Paolo, for the nice introduction. And as mentioned, we will talk together about Mycoplasma hyopneumoniae infections with emphasis what is new or what has been found in the recent years and things that are also important for the practice. So my presentation will cover the following items: a few words on the pathogenesis and interactions with the animal, also interactions with other pathogens. We will talk about control measures, vaccination, and also a few concluding remarks about eradication or elimination of Mycoplasma hyopneumoniae. Short introduction: as you know, Mycoplasma hyopneumoniae is consistently mentioned as one of the most important big diseases or pathogens worldwide. You also know that clinical disease is only the tip of the iceberg. Most infections are subclinical, meaning that we do not always see obvious clinical signs.
Sorry, Professor, to interrupt you. Marina, open the mic, please. Open the mic. Professor, go ahead. Sorry to interrupt you.
No problem. So subclinical infections are the rule, but we know that subclinical infections may also reduce performance, and these losses range from, let us say, 15 to 40 grams per day. And last but not least, MHIO is a door opener for many other respiratory pathogens, as you may know. Nose-to-nose contact or transmission via droplets that can be generated during coughing is the most important transmission route. Risk for infection by direct contact is 7 times higher than when pigs only have indirect contact. For instance, if they share the same airspace but do not have direct contact. MHyo is known for a slow transmission, a slow spread within a herd, in contrast to swine influenza, for instance, or other viral infections. Our N values, reproduction ratio values, have been calculated under experimental and also field conditions, and usually they are slightly above 1, between 1, 1.5, or 2 at maximum, meaning that the transmission is slow, and actually that having cedar animals in a group with the intention to infect contact animals is actually not reliable because of the slow transmission that may occur. We also know that the sow population is important to maintain infection within a herd, and that sows, the breeding population, may transmit the pathogen to the offspring, to the piglets. Here in this slide, you see the results of a study conducted in Brazil by Karine Taköti, and she examined actually breeding gilts from weaning onwards, from 3 weeks of age onwards, until these animals were almost 1 year old. And they sampled these animals by laryngeal swabs and did PCR testing. And the results of the number of positive animals is shown here in this figure and in the table. In the left figure, you see the percentage of positive animals. So they tested 44 gilts. And you see that actually the animals started to become positive at around 4 months of age, more than 100 days, that most of them were positive, of the highest positive rate was between 140 and 200 days, and then the prevalence slightly decreased. On the right side, you see the number of occasions that each animal was positive. So in the y-axis here, you see the 44 animals, and here on the x-axis, you see the age. And each dot is actually a positive tested animal. And you can see that for some animals, for instance here, this highest one, that animal was tested positive only once. Whereas there are animals that tested positive 2 times or also 3 times. So you have an intermittent shedding or positive rate. And also important, we are here in an endemically infected farm, is that 18% of the gilts always tested negative. So meaning even if you have a pretty detailed sampling frame, you still can miss positive animals. So it's important really to test a lot of animals and several times in order to be sure that the animal or that the farm is positive or not. The breeding population is important to transmit the pathogen to the offspring. How much positives do we find at weaning? Well, that varies a lot between the different studies. You have studies in which almost none of the animals are positive at weaning, whereas we have studies in which around 30% of the pigs are positive at weaning. So large variation between studies, but also a large variation between successive batches within a herd. So you can ask yourself, how is that possible? Well, we know that variation is important, definitely for Mycoplasma at all levels. But here specifically, we have some risk factors that may increase or decrease the risk to be positive at weaning. We have factors related to the sow, we have factors relating to the housing conditions, and we have also factors related to the management. The higher the infection level in the sows, logically, the more chance we have to find piglets positive at weaning. Studies have also shown that if there are large farrowing pens with a lot of sows in the same room, that also in these circumstances, we have a higher risk to test positive pigs at weaning. Also in farms that purchase a lot of gilts, that do not practice batch farrowing, that practice cross-fostering a lot, or that use a longer lactation length in which the risk for transmission is longer, then these are all factors that increase the positivity rate at weaning. Why is the prevalence at weaning so important? Well, because in some studies, but not all, but in some studies, it has been shown that the percentage of positive pigs at weaning or at a young age may be predictable for having clinical problems during the fattening period or for a higher prevalence of lesions at slaughter. To finalize the epidemiology and the transmission, actually important to know also is that once a pig or an animal is infected, it remains infected for a long period of time and may shed Mycoplasma organisms for several months, even up to more than 200 days, as has been shown in some studies. Let us have a closer look at the pathogenesis and the interactions with other pathogens. Mycoplasma hyopneumoniae adheres to the ciliated epithelium of the respiratory tract. This means at the level of the trachea, the bronchi, or the larger bronchioles, where ciliated epithelial cells are present. You can find Mycoplasma also in other places of the respiratory tract, but these places are not a natural site of multiplication. What is Mycoplasma hyopneumoniae doing? Well, it adheres and subsequently it induces ciliostasis. So the aspecific mechanism to defend the animal is decreased. And in the end, the cells with the cilia may die, so that we have a loss of cilia and that the animal loses its defense mechanisms. You see that here clearly in the picture. So the circles here represent the Mycoplasma organisms that adhere to the cilia. Here on the right bottom, you see a lung that is infected with Mycoplasma hyopneumoniae, and you see the typical cranioventral consolidation of the lung tissue. Typical for MHyo, however, not pathognomonic, because also other pathogens like swine influenza or other pathogens may cause similar lesions. So to be sure that the lesions are due to MHyo, you need actually to test the pathogen. However, if the location is in the cranioventral parts, it's typical for MHyo. If you take a piece of tissue from such consolidated areas and you look with a microscope, you see these type of lesions here. So a massive infiltration of lymphohistiocytic cells that actually can obstruct the lumen of the airways, so that it inhibits the normal passage of air in the lungs. Here at the bottom, you see normal lung tissue, and you see that there is quite a lot of empty spaces, meaning that air can be in there. You see some consolidated areas, areas with white blood cells. This is normal. This is the bronchus-associated lymphoid tissue, but it's not like in the figure upstairs where you have really this compression of the airways by the white blood cells. And actually, this is a reaction of the animal upon the infection, and it looks like the animal or the immune response is not able to clear this pathogen from the respiratory tract. And actually, this reaction from the immune system is also part of the pathogenesis. The host response is part of the pathogenesis and is actually not able to rapidly clear the pathogen from the respiratory tract and continue to accumulate, to attract white blood cells to the site where Mycoplasma organisms are. So Mycoplasma hyopneumoniae is a primary pathogen So it's not a commensal, really, it's a pathogen. If it's there, it causes problems, and it can cause disease by different mechanisms. Damage to the epithelium, as we just discussed, this lymphohistiocytic infiltration, as you have also seen. There is also an alteration of the mucus, and we also know from different studies that it modulates the immune system. So Mycoplasma hypopneumonia has quite some mechanism to severely damage the respiratory tract of the animal. And on top of that, also different studies have shown using dual infections that Mycoplasma hypopneumonia, if it infects an animal, that also infections with other pathogens are more severe. And this has been shown with PRRS virus, with PCV2, also with swine influenza, but also with the other bacteria like Actinobacillus pleuropneumonia, Pasteurella multocida. And it has also been shown that if an animal is infected with Ascaris sum larvae and on top with Mycoplasma, that the lung lesions are more severe. So these dual infections are interesting because they standardize in some way the infection, and it gives us an idea about the possible impact of Mycoplasma hypopneumonia in combination with another pathogen. Of course, these are experimental studies, meaning that they are a simplification of reality. Reality, field conditions are even more complex. We have more than 2 pathogens. We also have suboptimal environmental conditions, air quality management, and so on. But anyway, these studies clearly show the important and central role of Mycoplasma hypopneumonia. You can also see here below the table that there is some variation between the experimental studies. In some studies, a clear potentiation has been shown. In others, that was not the case, or less severe, or no interaction was found. And that may be due to the fact that different strains were used, the timing between the 2 infections was different, the dose, infection dose, and so on. So it's a simplification of the reality, but it can nevertheless be or provide useful information. And I think also Roman will show some more recent studies on the interaction with porcine circovirus type 2 and MHIO. We also know that there can be an interaction with mycotoxins. You know, mycotoxins occur quite common in our European pig feed. Fulminizin B is a mycotoxin known to cause problems in the lung and cause edema. It's also known in humans. And a study in Eastern Europe has shown that actually that if pigs consume feed with fulminizin B in the feed, that the lesions upon challenge of MHIO are more severe. We performed also a study some years ago in which we added DON in the feed. You know, DON levels are regulated by the EU legislation. It can be maximum 900 microgram per kilogram feed. We added double the dose, but however, we could not show that these double dose of DON increased the severity of our challenge model or MHIO infection. Also important is the diversity about MHIO. We have seen from different studies that Mycoplasma hypopneumonia, at least at the genomic level, is a very heterogeneous pathogen. There are different techniques to investigate or describe the genetic or genomic variation. Anyway, so far, there is not really a genetic marker that can predict the virulence of the pathogen. Many researchers have tried to find such a marker. However, none of us was successful. However, what we have shown is that if you have batches of pigs and you test with MLVA, which is a type of test to characterize the genomic diversity. If you have different MLVA types, to say different isolates of MHIO, and in this case, you have more severe disease, you have more lung lesions, more higher prevalence, and also higher severity of lung lesions. You could say, well, yeah, maybe that's true, but maybe in these cases you also have more other pathogens, or maybe the farm conditions were worse. That is true. However, in our statistical model, it was corrected for other pathogens and also for farm conditions. So apart from the effect of these variables, still more or different MHIO strains in a group of pigs was significantly associated with more lung lesions. Then a few words also on the diagnostics and the testing of Mycoplasma hyopneumoniae. You know that isolation is very difficult, and therefore in the field we usually use PCR testing. You know, PCR, we do not know whether the pathogen is viable or dead, but we have a rather quick result. It's a sensitive test. You know that we have different type of PCRs, mostly, or we use now quantitative PCR or real-time PCR. More important is also for the interpretation of the result is which sample has been tested. And you'll see here a schematic representation of a pig. And yeah, we can test or take samples here in the nose, more at the level of the tonsils, the larynx, or we can test or take samples in the trachea or the deeper parts of the lung. Actually, the most sensitive samples are the ones taken deeper in the lung, at the level of the trachea or the bronchi. And we can do that by meaning of swabs, or we can also use bowel fluid or collect bowel fluid. So in different studies, it has been shown that these are the samples where we have the highest chance to find positive results. We can also find MHIO in the nose, although this is not the natural site of multiplication, but of course the air goes in and out via the larynx and the nose. And so that's the reason why we can also find positives there. Oral fluids may work for some viral pathogens, but actually are not reliable for Mycoplasma hyopneumoniae. Low sensitivity and also no consistent results. Processing fluid has also been shown to test positive for MHIO. However, further research needs to confirm that and also to exclude the possible contamination during the testing. So the most sensitive method or procedure is take tracheobronchial swabs or collect bowel fluid and test with PCR. Serum antibodies can also be used. We have different ELISAs, blocking ELISAs or indirect ELISAs. We know that with these ELISAs, usually IgG is tested or measured. The response is quite slow. Upon experimental infection, pigs become positive 2 to 3 weeks post-infection, whereas in case of contact infection, the pigs become positive 4 to 8 weeks after infection, and there is a large variation. The serological response upon vaccination depends on whether we vaccinate once or twice, whether the animal has maternal antibodies. We also know that there are differences between vaccines, so quite some variation. Serology has its limitations, but also has some advantages. It's easy, it's fast, it's cheap, and we can obtain some information about the presence of the pathogen, the time in which most animals become positive, so we can also have an idea about the level of infection. Disadvantages are serological response is slow and variable. We know that there is no correlation between the serum antibodies on the one hand and clinical protection on the other hand. And in case that we vaccinate our animals, or in case we take blood in pigs at a young age, maternal antibodies may complicate the interpretation of a serological result. In terms of control measures, well, management and housing conditions are very important. I would say not really very new studies or studies that have elucidated something new. However, these procedures, these measures remain nevertheless the basis for the control of Mycoplasma hyopneumoniae infections. That was the case 20 years ago, and that will very likely be also the case within 20 years. So management and housing conditions remain the key and also the first steps in optimizing the control of Mycoplasma hyopneumoniae. Aspects like pig flow, stocking density, biosecurity, and all that, all these aspects need to be done properly. And of course, also everything that has to do with ventilation and stable climate. We will not go in that in detail. An important aspect in that, and there has been some studies on that, is the purchase policy and the gilt acclimation practices. We have seen at the beginning of the presentation that the breeding population is important to transmit the pathogen to the osprey, and especially the younger sows. Well, then raises the question, what should a farm do if breeding gilts are purchased? And we know that more than half of our pig farms, sow farms, purchase breeding gilts in order to keep up with the genetic progress of the sows. If your farm, recipient sows, if your farm is negative, then you can buy negative gilts, that's fine, but anyway, it's recommended to put them in an isolation period to verify whether the gilts that you purchase are really negative. Of course, if the incoming gilts are positive and your farm is negative, no gilts should enter the farm. If your farm is positive, then irrespective of the status of the incoming gilts, an acclimation period is needed in which we can test the incoming gilts and also in which we can vaccinate them or apply other acclimation practices. Gilt vaccination is commonly done in farms, and why? First, to prevent clinical disease, and secondly, also to decrease infection levels and shedding, and in this respect also to avoid a destabilization of the breeding stock immunity in terms of Mycoplasma hyopneumoniae. These regarding the general control measures, then we also have the vaccination itself and the eradication. Let us have a closer look at these aspects now. For MHyome, most of the vaccines that are commercially available worldwide are bacterians or soluble antigens with an adjuvant. There is an attenuated vaccine that is used in China and also one in Mexico. But most elsewhere, so most of the vaccines are, let us say, the old-fashioned bacterians. Nevertheless, these are efficacious to reduce clinical signs, lesions, performance losses, and also bacterial load in the lung. However, they do not prevent colonization, and we know that they have a limited reduction on transmission. Maybe if you vaccinate repeatedly, that transmission will also be reduced, but in the normal vaccination schedules, colonization is not prevented and transmission still can occur. So vaccination alone is not sufficient to eliminate infection from pig herds. We do not have a sterile immunity, which is the case for many vaccines that we have in pigs, and likely also in other animals and possibly also in humans. In terms of immune responses or defense of the animal against Mycoplasma hyopneumoniae, we can classify them into 3 groups. First, we have the physical, chemical, and microbial barriers. In case of MHyo, then we speak about mucociliary clearance and possibly commensal bacteria. Then we have the innate immunity, complement and cells like macrophages, natural killer cells, dendritic cells. These cells are present at birth and they can induce an immediate but a specific protection. Very important, and so far I think a little bit underestimated in the control against infectious diseases. The last part is the adaptive immunity, and there we have the 2 groups, the humoral responses, mainly induced by B cells, antibody responses, and then the cell-mediated immune response, composed of CD4 T helper cells, Th1, Th2, Th17, and the regulatory cells, and then also CD8 cytotoxic cells. This adaptive immunity is acquired. It's specific for specific pathogens. It retains a memory, and also it improves with experience. So the adaptive immunity is mostly what we try to achieve by vaccination. We have performed some studies with new bacterial formulations against experimental Mycoplasma hyopneumoniae infection. So I would shortly discuss the results that we found. Actually, we did 2 types of studies. First one was looking at safety and immune responses, and in the second step, we tested the efficacy. We tested different formulations, but I will only show the 3 most interesting products for which we obtained more good results or relevant results. The first one was a formulation with liposomes and with the Minkel agonist as immunostimulant. Then the second product was based on microparticles with different mixture of toll-like receptor ligands as adjuvant. And the last one was with the same adjuvant, but an oil in water product. And we used a virulent field strain of Mycoplasma hyopneumoniae at a dose of 1/9, and we applied mostly intramuscular application. So the first product we used a combined first intradermal and the second injection intramuscular, and the other 2 were intramuscular. In general terms, safety was okay, except for the intradermal application, but that might be due to the device that we used. Antibody response was not so pronounced. We found some serological response with product 1 and 3, and only in 1 pig a local response. However, with these 3 products, we found a response Th1 and or Th17, which are considered to be most important for the protection against MHyo. And you see that also with product 1 and 3, we found CD8 positive responses. So we used these 3 products then in an efficacy study. So here the 3 groups, and of course we had a positive and a negative control. Vaccination was done twice with 2 weeks in between, and 2 weeks after the second vaccination, the pigs were challenged, and then classically 4 weeks after the challenge, the pigs were euthanized and the lung lesions were evaluated. The classical efficacy parameters were measured, being coughing, lung lesions, and MHyo load in the lungs. And actually you see the results here in this table. For all the products and the formulations, there was a reduction of these parameters in the clinical signs, the gross lesions, the microscopic lesions, and the MHyo load. But the most pronounced results, or the best results, were obtained with the formulation oil in water with the different toll-like receptor ligands as adjuvant. So we were quite happy with this result. We expected actually that also having the formulation or the antigen in microparticle form would confer good results, but obviously the classical oil and water formulation appeared to be best in this study. We have also performed a study with Hyogen against experimental MHyo infection. And you see the results here in this table. So here in the second column, you have the results of the Hyogen. We had also another MHyo vaccine as control. Then interesting also, we had Hyogen without antigen, so with anything else, but not the antigen, and we had a positive control. And you can see that we looked at the respiratory disease score, the microscopic lung lesions, and also the serological response. And actually the best or most pronounced results were obtained with Hyogen, compared to the control group and also compared to the other vaccine. And interesting also, we obtained some protection or some improvement of the challenge with the formulation without the antigen. And this may point to also an important role of the adjuvant in the vaccine, and possibly also the role of the A-specific immunity, the innate immune responses in the protection of Mycoplasma hyopneumoniae. Then a few words about eradication before we conclude the presentation. So you have seen we have quite different tools to control MHyo, but we also have the limitations. We are limited in terms of improving biosecurity and management because we have imperfect stables, we have an imperfect farmer, the conditions may not be optimal as we would like them to have. So eradication or getting rid of the pathogen may be an option in certain conditions. Why? Well, we know that farms that do not have MHyo on their site, that the performance is better, that we have less secondary pathogens, less antibiotics, better welfare, and also the morale for the caretaker might be better. Recent studies in the US showed that if you can get rid of MHyo, you have a benefit of $5 per pig, which is quite substantial. However, the decision to eliminate MHyo should not be taken so easily. It's important to consider different aspects. It may depend on the disease impact, how severe are the problems on a farm. The more severe, the more likely elimination might become interesting. You might also consider eradication of other pathogens, like PRRS or some strains of Lactobacillus pleuropneumonia. And you should also realize that if you are in a pig dense area, that there is a chance that you become reinfected, that after all the efforts you have done to get rid of the pathogen, you might get it back from your neighbor. However, if you have done that exercise and you have considered that elimination is something for your farm, then different protocols can be used. We will not detail them, but I just would like to give a dendrogram of different possibilities when you consider elimination of Mycoplasma hyopneumoniae. And it's based on the chapter in the book Mycoplasmas in Swine that was published last year, and that chapter was written by Dr. Jeske and Maria Peters. So here on the left side, this is control. That's something we discussed already. Here you have elimination. You can choose a fast elimination track, and then we talk about depopulation, repopulation, actually the most effective one, but not something that is possible in every situation. And for many farms, also the most expensive option. Then we have medication without herd closure. These are the fast elimination tracks. Then you have the slow elimination, interrupted pig flow with interrupted pig flow. So that's the Swiss method. What does that imply? Getting rid of all the young animals, interruption in farrowing for a couple of weeks, and medication of the remaining animals on the farm. Might work well in small farms. In larger farms, it's more difficult. And then we have another option with non-interrupted pig flow. This implies herd closure and also mass medication of all the piglets and animals actually that are on the farm. So this is in a nutshell the different options that you might take in case you would opt for elimination. So in conclusion, MHyo is a key pathogen within the porcine respiratory disease complex. I hope to have illustrated that the pathogen interacts in a complicated way with the animal and has several mechanisms by which it can damage the animal and the respiratory tract. Different control measures. First, do the basic things in terms of management and housing first, and then consider vaccination and other measures. We know that vaccination is commonly used in piglets and also in breeding guilds as an acclimation practice. It's cost efficient in many pig farms. However, the current vaccines still have their limitations, so there is quite some research ongoing to develop experimental and new vaccines that hopefully might provide a better protection. Eradication might be an option in some farms, but different considerations should be made, and also different protocols are possible. And with that, I would like to thank you for your attention. And if you would like to have more information about Mycoplasma hyopneumoniae, but also other mycoplasmas in swine, you could read the different chapters of the book that was published last year. So Paolo, with that, I will stop sharing and give the floor to you again.
Mille grazie Dominik, grazie per la presentazione, il contributo. Credo che sia stata una presentazione estremamente chiara e che ha portato anche degli aspetti che riguardano appunto le ricerche che si stanno continuando ad effettuare su questo patogeno e sul ruolo che questo patogeno ha attualmente nella suinicoltura, anche perché siamo in un ambito di grandi cambiamenti, soprattutto per come gli animali devono essere gestiti, anche dal punto di vista dell'utilizzo eventualmente di alcune soluzioni che fino a poco tempo fa potevano contribuire a cercare di controllare meglio la patologia. Gli studi ci stanno dimostrando anche altre cose e di conseguenza direi che la tua presentazione è stata senz'altro molto chiara ed esaustiva. A questo punto passo allora a presentare il secondo dei nostri relatori di oggi, che è veramente un piacere avere qui con noi, e cioè il professor Mateu, che è professore di Animal Health alla Facoltà di Medicina Veterinaria di Barcellona ed è anche ricercatore presso il CRESA, sempre a Barcellona. È conosciuto da tanti di noi per molti studi che hanno riguardato diversi patogeni, in particolare l'eziologia virale, che coinvolgono il suino, e ha svolto questa sua attività di ricerca ovviamente non solo in Europa ma anche negli Stati Uniti e più precisamente in Illinois. Ha partecipato a tantissimi progetti di ricerca che hanno avuto a che fare con vari protagonisti virali delle patologie con le quali ci confrontiamo tutti i giorni, quindi il virus della PRRS, in particolare il virus dell'influenza e anche il PCV tra gli altri. In questa occasione ci presenta un lavoro invece dedicato in modo particolare alle relazioni che si stabiliscono tra il complesso dell'influenza, della patologia respiratoria del suino e l'influenza suina, proprio per andare ad investigare in che modo questa può interagire con questa sindrome. Di conseguenza vi auguro di nuovo buon ascolto e buona visione e Enric, the floor is yours nearly.
So good afternoon, everybody. Thank you for inviting me to this today conference or seminar. I will talk a little bit about the swine influenza problem, and my first approach to that would be a general overview of how we manage the farms and how this has an influence in the way we are seeing now influenza. For many years, swine production has been, let's say, focused on farrow to finish farms with a reduced number of sows, using internal replacements in farms with relatively low productivity, with a long life, productive life of sows. And in this type of farms, one very important aspect regarding the epidemiology that now we are seeing in influenza is that we had a small proportion of incoming animals from the external sources. We had continuous flow systems within the farm, and normally we don't have movement of animals between different sites. So this type of farms, and obviously this is kind of a gradient. I mean, it's not a yes or no. You have different intensities of that. Had a relatively low risk of introduction of new pathogens because they were a little bit close on themselves. They have a continuous flow that promoted transmission of the infection within the farm. And the early infection of the internal replacements produced more or less a immune stock of breeders. In this type of farms, on the other side, the control of the infection was very difficult because this close contact between animals. In the systems that we have, the current trend is towards 2 or 3 site systems with a high number of sows. The average farm now in Spain is about 1,200 sows. This is the average, the normal one, with external replacements that have to be introduced, that must be introduced continuously in the farm, and with a shorter productive life of sows. So if we look at the epidemiological features of these farms, we have a constant flow of incoming animals, in this case gills, but can be fatteners in other sites. We work in production batches, and we require the movement of animals among the different sites. So this constant introduction of animals increases the risk of introducing pathogens, but on the same time, we are reducing the risk of transmission between different phases because of this different site system of production. Again, the introduction of external gills require acclimation and requires an immunization of these animals that are entering our farm. And on the other side, the infection in the wineries can be very important because our intensity of production, the number of piglets produced per sow, is increasing. If we look at the things that are happening in the framework of the, let's say, the lifetime or the cycle of production within the farm, we have several critical points. First, we are introducing these gills, and they can be the source of infection of the farm. They can introduce new pathogens in the farm, but also if they are not acclimated enough, they may introduce susceptible animals within the breeder's stock. This sow stock needs some type of recall contact with the antigen, because if not, they may lose immunity and they may favor transmission. And this is the situation in which, for example, within the breeder's stock, we have immune animals, susceptible animals, and infected animals. On the other hand, the production system that we have in working in weekly batches or 3-week batches, for example, produce huge amounts of piglets in every batch. Obviously, if everything else before was done in the right way, these animals will have some protection because of the cholesterol transfer. But anyway, sooner or later, these maternally derived antibodies will decrease. And this will open an opportunity for the pathogens to transmit. So we have a critical point here. These animals were immune or partially immune rightly after birth, then they are decreasing immunity, and sooner or later, they will be fully susceptible to the pathogens in the farm. If we have a pathogen that is easily transmitted and we have infected animals, or the animals can be infected from the facilities, most of these animals will become first infected, and probably then they will become immune, and the infection will disappear or will attenuate in later stages. So if we put this in a timeline, what we have first is a phase in which the animals in the maternity can be infected by the vertical transmission. This would be the case of PRRS virus, or they can be infected by contact with infected sow or with fomites, or with naval litters that are infected in that maternity. So these animals will be protected to some extent by the maternally derived immunity. As the animals grow, the transmission will increase as the maternal immunity fades out. And that means that the loss of this maternal derived immunity will correlate with the an increase in the clinical incidence or the mortality in the farm. Normally, for most of the pathogens, we have a very little impact in maternities. The disease is observed in the nurseries, and then in late phases, we have secondary or complicating agents, normally bacterial agents, that will predominate at later ages. This is a very general scheme. If we look particularly to influenza A in pig farms, the classical presentation that we were taught when we were studying infectious diseases many years ago was the epidemic presentation. And the history was something like, when you have influenza in a farm, it's because you introduce a new strain into the herd, and this herd had no previous immunity, and this causes explosive dissemination in animals of phages. If we built up a graph with those data, the typical outbreak of influenza will be something like that. In 1 to 2 weeks, all the animals or most of the animals in the farm are infected. Apparently, this is less and less frequent. Why? Because probably now we have a lot of herds that are infected by more than one influenza virus, and because there is a certain degree of cross-protection. It's a well-known fact that when an animal has been infected by more than one influenza strain, the protection increases in breadth. In other words, if you are infected by just a single virus, you are immune against that variant of influenza. If you are infected by 2 variants, probably the scope of, or the panel, or the diversity of the strains against which you have some level of protection is higher. When you look at the current pattern of the influenza infection in most farms, what we have is an endemic presentation. And in this endemic presentation, often cases are only seen in nurseries. What are the features of this endemic presentation? The first one is the lower incidence. If in the typical outbreak, all the cases in the farm accumulate in just 1 or 2 weeks, in these cases, what we have is a lower incidence, but outbreaks are recurrent. Normally, we see some cases like drop by drop in the nurseries until a moment when the disease explodes, then the disease fades out, and in the next batch, we'll repeat the same pattern. And this persistence of the virus in the herd, not in the animal, in the herd, is because of these population dynamics that I explained before. We are constantly introducing naive animals in the farm, normally the gills are not probably immune to the variant or to the strain that we have in the farm, and then we are producing a constant flow of animals that will be susceptible in the nursery. So if we look at that, we have 3 main focuses of infection in the farm. These gills, because they are either naive or they have less immune experience. The suckling piglets, because animals can be infected in the presence with maternally derived antibodies, and this is a very important point that has not been enlightened enough to understand what happens here. We know that a suckling pig can be infected even with maternally derived antibodies, and we also know that these animals that are infected in the presence of MDA probably will not become fully immune after recovery. So the first section will depend on the gills. The more the proportion of gills that we have in the farm, probably the easier the infection for those animals because they have less immunity. And in the farrowing unit, we can have one transmission from the acutely infected gill sow to the piglets, but also we can have indirect transmission by aerosols, airborne transmission by fomites, by the contaminated floral facilities, or even by the person. And the third group of animals, as I told you before, are the nursery animals, the weaners that we have here. When these animals lose maternally-derived immunity, the infection rapidly spreads and probably rapidly will decline. If we look at the proportion of positive tests on suspicious animals by phase, and these are data from 2 years, 2018, 2019, in our lab, you can see that of all the submissions that we have, about 40% came from nurseries. And of these, about 60% were positive for influenza. The proportion of suspected cases of influenza in maternities were just 17%, 13% in fatteners, and much less in other cases. And about 22% of the cases reported clinical disease in more than one of these groups. So in other terms, 70% of the cases happen between the maternity, the nursery, and the fatteners. So in very few weeks, all the cases accumulate in these endemic forms. Who is causing this endemic influenza in our farms? Basically, we have the three classical subtypes, H1N1, H1N2, and H3N2. Certainly, you can find from time to time some different subtypes like the H3N1 or some others, but more than 95% of the cases are produced by one of these three subtypes. But the subtype classification is very little informative. I mean, the information that gives us the subtype is very little. Why? Because within a given subtype, we can have different lineages with different antigenic properties and with different cross-reactivity in the serological or in the immune test. The most common until very recently was the H1N1 avian influenza virus. Avian refers that this virus was introduced from an avian origin into the swine population. The origin of this virus is dated back to 1979. Then we had the H3N2, and this was a human virus. This H3N2 of 1984 correspond to the, let's say, the progeny of the 1968 human virus. And this H3N2 is less and less common in Europe. Then we have one H1 of human origin that was introduced in the peak in 1994. And finally, we have the H1N1 pandemic of 2009. So at present, we can have viruses harboring genes from the pandemic virus of 2009, viruses harboring genes from the avian virus, originally avian virus of 1979. We can have viruses harboring genes from the human H3N2 of 1984, or even we can have H1 viruses coming from human strains dated some years ago, or even we can have some new introduction of human viruses of the seasonal influenza. So if we look at that, to add some, let's say, some more complexity to that, when these viruses were examined gene by gene, it was very clear that the diversity was even greater than that defined by the lineage. And genotypes were defined. The genotype, when we talk about the genotype of influenza A viruses of swine, we're talking about the composition of the different genes of the virus. As a matter of fact, we use this classification to understand how the different viruses are reassorting one to the others. If you look at here, this is a scheme. This is the scheme originally reported by Watson with the addition of some new genotypes that have been reported this last year. And you can see that the thing that we are doing that is something like, what is the origin of each gene that we found in a given strain? We have the M-agglutinin, the neuraminidase, the non-structural protein, the matrix, the nucleoprotein, and the 3 polymerase genes. For example, this first genotype that is called genotype A is the original avian-like H1N1. All the genes are green, so all the genes correspond to the original avian H1N1. But we can have other genotypes, for example, these ones here, that combine genes in red from the pandemic virus with other genes in the virus that come from the original avian H1N1. In other words, this, for example, is a reassortant that contains the matrix of the pandemic virus plus all the other genes from the original avian H1N1. And we can have things that are more complex. For example, this one here, the unreported genotype 5. So it's new genotype 28, according to the classification. This virus, for example, contains some genes, that what they are called internal genes, from the avian-like virus, contains the hemagglutinin from a human H3 virus coming from Malaysia, and contains a neuraminidase from the classical Ghent virus H3N2. So what is this telling us? This is telling that probably the complexity of this influenza virus is even higher than reported up to now, and that all these reassortments are taking place probably in our pig farms. What are the types or lineages more common in Europe? In this slide, you can see, for example, that for the period 2008-2013, in Italy, the predominant lineage was the H1N1 of avian origin, with some representatives of the H3N2 and the recombinant H1N2. If you look at the period 2010-2015, I don't know if the figures can be read very well, but anyway, H1N1 of avian origin is still predominating. H3N2 accounts for roughly a quarter of the isolates in Italy, but H1N2 is about 20% of the viral detections of swine influenza in Italy. And this is again telling us something very important. These are snapshots. The figures that we have for a given period necessarily do not represent the figures for the next period. And as a matter of fact, this is a very changing situation in which the subtypes and the lineages are changing, are reassorting between them, and the predominant strains or the predominant variants are being modified according to some elements that are not fully understood. What is the clinical, productive, and economic impact of influenza in the pig farm? The pathogenesis of influenza, it's very simple because the process is an acute viral infection of the respiratory tract. The infection normally starts by the inhalation of an aerosol. You have an infection of the epithelial cells. You can see here very well trachea, bronchus, and then less infection as you go deeper in the respiratory tract, bronchioli or alveoli, very little infection. You have a huge replication of the virus in this epithelia. The inflammation of the airways is very important, and this is mediated by cytokines, pro-inflammatory cytokines. This causes a serious cell damage and loss of the epithelium, and normally you have fever in those animals. If the cases are not complicated, normally the recovery happens in 5 to 7 days, and full lung recovery takes about 2 weeks to happen. One important thing is that the destruction of these defenses of the respiratory tract result in a decreased clearing of bacteria because you are destroying the respiratory epithelia. Permits also the attachment of some bacteria to receptors that were not accessible before the infection, probably because the mucus or the cilia, the respiratory tract, were able to clear those infections, were avoiding the bacteria to reach the receptor on the sensor phase. And then also there are some bacteria and some debris that can fill the lumen of the trachea or of the bronchi and can fall to the lung. As a result, it's very common to have bacterial complications after an influenza infection. Besides that, there are some synergies between influenza and other pathogens. One of the most cited synergies is with Mycoplasma hyopneumoniae, also with H1N1, but also with H1N2. And Dominik, before, show you some pictures about the lesions of Mycoplasma in the lung, and you can compare here, for example, H1N1 plus Mycoplasma versus H1N2 with Mycoplasma, apparently H1N1 and Mycoplasma is a little more severe than H1N2. Also, this synergy is translated to worse daily weight gains, but also we have co-infections with Actinobacillus pleuropneumonia that can be synergistic, or we have other pathogens like strep suis or other bacteria that have been related to the let's say the complications that happen after the influenza infection. If we look at the impact of influenza in maternities, this will be the less common case. Influenza in maternities up to now with the available data is a problem in Denmark where it's pretty common, not so much in other countries. But anyway, influenza in maternities, you can see, produce about, let's say, 1% more of mortality compared to an average of 1 point something or up to 2 or 3% higher mortality in maternities. So is this important? Yes, you are increasing mortality. Is as important as spurs in maternities? No, it's much less important. If we look at nurseries, the figures are a little bit different. And we can refer to two papers. One is a little bit old, Gillespie 1999. The other is from Montse Torremorell in Minnesota in 2009. And they evaluated the different parameters related to the infection in the nurseries. More or less, the value for the excess mortality was about 2%. The decrease in the intake was calculated about 20%. The change in weight at the end of the nursery phase between 10 and 30%. Medication costs were evaluated in 80 euro cents, I mean, making the change from the dollar to the euro. There was a report of increasing bacterial infections like strep suis or Pasteurella multocida. And normally they consider that the duration was the whole nursery period. In our hands, and we have not published that, the cause that we attribute to the influenza is about more or less between 1 and 2% mortality, extra mortality in the nursery phase. In another study, in which the authors compare 137 batches of the same company and in 3 groups, batches with influenza, 20 batches with respiratory signs, but without a proper diagnosis of the agent involved in the 13 batches, and healthy batches, 100 batches. The influenza was calculated to be the cause of an increase of about 0.8% of the mortality rate. So this is roughly 1/4 of these mortality rates that were on average here. So it's not very big amount, but it's amount enough to be considered as important. How we diagnose and monitor influenza in a farm. Diagnosis of influenza, or to say it better, to detect influenza in a farm is not that difficult. If you have infection, and we consider that the infection starts at day 0 and viral clearance happens between day 5 and 7. And this can be, let's say, true for most animals, but not for all. Some animals seem to be prolonged shedders that can shed the virus for up to 2 or 3 weeks. But anyway, if we consider this 5 to 7 days as the average period of shedding for most animals, viral detection can be done obviously by using of nasal swabs. Nasal swabs are usually positive during this 5 to 7 day period. And obviously we have animals that were dead and we can do the necropsy. The lung is the election sample. Can we detect the virus in oral fluids, for example? Yes, but this is very misleading because oral fluids are positive in almost all farms at some moment during the nursery. So we have to be very careful in what we are doing. If we want to diagnose a clinical problem of influenza, our selection should be infected animals or suspected animals with clinical signs compatible with influenza, and that is mostly cough and fever. If we do or we attempt the diagnosis by serological means, the circumvention takes between 14 and 21 days after the original start of infection, and we can use ELISA or the hemagglutination inhibition. In my particular opinion, both methods are very bad for the detection of, not for the detection, for the diagnosis, proper diagnosis, because they are very dependent on the type of antigens that you are using, particularly the hemagglutination inhibition. What are the lesions? The lesions are very typical. This is bronchial interstitial pneumonia.
Professor, excuse me.
Sorry.
Marina, can you fix your audio, please? Okay, go ahead. Sorry, Professor.
Okay,
You can
thank
start
you.
again.
No problem. I was saying that the typical lesion is the bronchial interstitial pneumonia. This picture here sometimes can be a little bit confused with the Mycoplasma hyopneumoniae lesions. And in very severe cases, we can have a whole affectation of the lung, but this picture here is prototypical of an acute case of influenza. As I told you before, the target for the diagnosis of clinical problems is the pig with fever. Normally, we consider fever above 40. Most animals with influenza are above 40.5, so it's easy to identify them. We take nasal swabs, and I recommend to take between 10 and 20 nasal swabs. My advice again is to include in the testing non-symptomatic animals, because sometimes what you have is another pathogen causing the respiratory disease together with some asymptomatic or very mild influenza infection in your nursery. The test for the diagnosis is the PCR, a positive PCR, and you have different systems of PCR from the typical endpoint PCR to real-time PCR. You can do multiplexing to determine the subtype or the lineage, or just to confirm that you have influenza A or not. I mean, every lab uses a different system, but this is really sensitive for most cases. And then regarding the blood samples, if you are doing blood testing for serology, I recommend always to do this examination of 2 pair samples separated no less than 14 days. In most of the farms, 90% or more of the herds, you have seropositive animals. So you have to be aware of that, because sometimes serology is used, and particularly ELISA is used as an indication of infection. This is not a good strategy. If you know the strain that you have in the farm, maybe hemagglutination inhibition can be a little bit better, but ELISA serology is not a good approach for the diagnosis. An important point is to know what lineage or what type of strain do you have in your farm, and normally this can be done by real-time PCR. Sometimes this is not possible, and you have to rely on doing repeated sampling in the farm or doing isolation and sequencing. If you have any question, I can talk a little bit more about this later. As I told you again, oral fluids can be a choice for monitoring, just to know if you have influenza or not in your nurseries, but it's not very, I mean, it's too sensitive, and all nurseries sooner or later will be positive. I prefer other alternatives to understand really what's going on in your farm, like nasal swabs of clinical cases, or even other sampling or family oral fluids in maternities, just to understand if you have an early transmission of the infection or not. Let me skip this one, and let's talk about control and prevention. When we face the problem of controlling influenza in a farm, the first thing that we have to consider is what is the problem of the farm. I want to control influenza because I have productive problems. My productive parameters are going down. My problem is an increased mortality. My problem is increasing medication cost, because every one of these situations will have a different solution. Anyway, whatever the problem, the first point is to have a good confirmation by the lab of what is the circulation, where the virus is circulating and is creating problems, or it's just a subclinical circulation. And again, remember that we have three main focuses of infection: the gilts, the suckling piglets in the maternities, and above everything else, the nurseries. So what is the problem of the farm? Normally, the problem of the farm is that I have circulation of the virus in the farrowing units and nurseries, and I want to stop it because this is increasing the mortality in these two phases and the medication cost. Our current knowledge says that vaccination of sows and gilts can limit reinfection in farrowing crates. I mean, if we have immune sows, obviously transmission from acutely infected sows to piglets is decreased because we have less infected sows in the farrowing crates. The second important point that we have to consider is that mixing of animals of different age is a very important source of transmission. And we can manage that through all-in-all-out systems, or by doing batches, bigger batches, instead of every week, every 3 weeks or every 4 weeks. This is very easy to be said, but very difficult to implement in the farm. Or, for example, having site separations between pens can help. If we have positive fattening units, and sometimes this can be a problem, influenza is exploding in animals beyond 30 or 40 kilos of live weight, the question is if it is worth to implement vaccination in those animals. And for this, we have to answer first if influenza is a real problem in that farm. Again, go back to the examination of the infected animals. Do we have lesions? Do we have other pathogens in combination? Are we having a huge impact in the productive parameters of the farm? What vaccines can do for controlling influenza? I will present you very rapidly an experiment that was done at the University of Minnesota some years ago under more or less controlled conditions, in which they had 3 groups of animals. Group number 1 was vaccinated with vaccine A. Group number 2 was vaccinated with vaccine B that was 92% similar to A. And the third group was an unvaccinated control. And these animals were infected by contact with infected seeders that had been inoculated with the strain A, and they were being followed up for 14 days. You can see here what happened. For the animals that were non-vaccinated, this is the controls, the reproductive ratio was about 10. In other words, all animals were infected in less than 5 days. For the animals that were subjected to the homologous challenge, I mean, they were vaccinated with A and they were infected with a seeder inoculated with A, the reproduction ratio was 0. In other words, there was no infection. So homologous protection was fully effective. For the animals that were subjected to the heterologous challenge, vaccinated with B and challenged with A, reproduction ratio was 1. There was some level of transmission, but after 14 days, more than 60% of the animals remained free of the infection. So, in other words, even in the heterologous situation, you have some impact. Vaccination helped to reduce the incidence and helped to flatten the curve. So at this point, it's very important to determine if this is what you need for your farm. In the nurseries, it's very important to reduce mortality. So having a good maternally derived antibodies can help. If we think about the positive fattening units or vaccination of animals after 6, 7, 8 weeks of age, not just the sows to transfer maternally derived antibodies to the piglets, this is more doubtful. If vaccination helps to reduce the spread of the virus, and it helps a little bit, the problem is that you have very little impact because of the high diversity of the viruses that are circulating. In other words, if you produce maternally derived antibodies, because you are vaccinating the sows, you are giving some protection to the younger pigs, you extend this protection to the nursery, and by this you can reduce mortality. If you want to vaccinate fattening animals or you want to vaccinate late in the nursery, maybe the lack of correspondence between your vaccine and the circulating strain is enough to produce very little results. So you have to always test what type of strain you have in your farm and see if you can match it with the vaccine that you have available. So thank you for your attention, and I leave the room for the next speaker.
Mille grazie Enric, è stato veramente un piacere avere la possibilità di vedere questa presentazione. Direi che il quadro che ci hai fatto a partire appunto dall'epidemiologia dell'influenza nelle aziende, dalla distinzione tra la presenza endemica del virus influenzale, l'arrivo dei nuovi ceppi ed in particolare quello pandemico, con gli impatti produttivi ed economici, oltre che ovviamente i risvolti clinici che questo ha comportato, è stato effettivamente molto chiaro, così come la parte sul discorso di controllo e di prevenzione della patologia, per cui ti ringrazio ancora tantissimo per il tuo contributo. E passo a questo punto ad introdurvi il terzo relatore della giornata di oggi, che è un piacere avere qui con noi perché Roman è un amico ed un collega. È una persona che lavora nel gruppo SEVA da molto tempo, è specializzato ovviamente in swine health and management per quello che riguarda appunto il settore suinicolo, è stato responsabile tecnico SEVA prima in Europa e poi dal 2008 ricopre questo incarico a livello mondiale. È attualmente la persona che segue più da vicino, in modo particolare, il range dei nostri vaccini, in particolare focalizzandosi su Mycoplasma, hyopneumoniae e PCV, ed è autore di oltre 50 articoli scientifici che sono state pubblicate su riviste specializzate ed impattate. La sua presentazione di oggi, che chiude le presentazioni che abbiamo avuto modo di affrontare nella giornata e ci porta poi alla sessione domande e risposte, è l'interazione che in modo particolare il circovirus può esercitare nei confronti del complesso respiratorio suino. E quindi è con piacere che lascio la parola a Roman per l'ultima delle presentazioni tecniche della giornata di oggi. Roman, thanks a lot and the floor is yours.
Thank you very much, Paolo, for the introduction. Good afternoon, everybody. In my about 40 minutes, I'd like to share with you some thoughts about the association, about the role of PCV2 in porcine respiratory disease complex. I hope you hear me well.
Yes, we can see your slides.
See the presentation. I will start a little bit about the PCV2 origin, the epidemiology, and pathogenesis. The PCV2 is still a bit mysterious virus. It has been identified first time in 1974, PCV2-1 type. It was found in the cell cultures, and it was concluded that it was not pathogenic for pigs. However, later on in 1991, the first PMWS outbreaks occurred, and PCV type 2 was detected as being the cause, together with the other factors, of those PMWS syndromes. Later on in 2005, the classification of PCV2 related disease have been made. Then in 2016, another type, another species of PCV was identified, PCV3, and recently also PCV4. Those two, there is still a lot of discussions if they are really virulent, if they are the cause of the disease or not, and what is the role of pathogenesis of some clinical condition in which they were identified. Globally, we know that PCV2 belongs to the most important pathogens in swine, and the losses are estimated up to $20 per pig. So this is the overview of different types of porcine circoviruses published recently by Professor Bresnik. We see quite big distance between PCV2 and PCV3. The similarity of the genome is very low, about 30%. That's why also there is no expected cross protection. This is quite a frequent question. If PCV2 has some relationship in terms of the cross reactivity or cross immunity with PCV3, so there is no this cross protection expected between those two viruses, and about PCV4, it's more or less the same. Now, specifically, some words about PCV2. PCV2 is the virus which tends to be quite flexible in at the genomic level, and there are many mutations observed, and already up to 8 genotypes have been described from PCV2A up to PCV2G. Of those, PCV2A, B, and D are being present globally. The others, like E or G, have been identified locally, some of them in China, some of them in the United States, and they do not have so far any real global epidemiological and economic importance. Now, PCV2A was the most prevalent, the first identified and most prevalent genotype until 2000s. Then there was described this supposed genotype shift towards PCV2B, which was associated with more severe clinical expression, more severe disease, and new disease outbreaks, even in vaccinated herds. Then later on in 2013, firstly, PCV2B mutant, later on denominated as PCV2D genotype was described. However, then it was found that all were present and co-circulating already decades before. And so it was not really the genotype shift. It was just more expression of some of the genotypes which were existing even before. And the reasons for that are still not known yet. So what is now the distribution of those different genotypes? And it's a very interesting thing. This was the repartition of different genotypes in almost 60 farms in Germany. It was published by Dr. Eddix from Munich University, and it shows the distribution of different genotypes in those randomly selected farms. And here we still see the most prevalent genotype A, then genotype B and D. However, if different researchers identify different genotypes in clinically diseased farms, in clinically diseased pigs, the picture is totally different. And we have seen in different continents, you see in the results published from South Korea, the results from Germany, the results from the United States. So we see that in clinically diseased farms, the most prevalent genotype was PCV2D, followed by PCV2B, and then PCV2A. So still, it seems that PCV2A is massively circulating in the herds. However, it doesn't cause those more severe severe disease. What does that mean? Is there any difference in the pathogenicity of different genotypes? And that's a very interesting question. The same Dr. Addix published very nice comparison between different genotypes and their kind of replication rate in pigs. And so his team found PCV2A in relatively smaller amount. We see in serum or lymphoid tissue about the median value about 4 logs. However, PCV2B and PCV2D in much higher amounts, so up to 9 logs. So it seems that the replication rate, the potential to multiply more massively is for PCV2E and D higher compared to PCV2A. So in different scientific works, it was claimed that probably PCV2B and D strains are more pathogenic, more virulent. However, some other scientists concluded that there was similar virulence found among different genotypes in experimental studies or in the field. However, still these differences in epidemiology are there. Now, very recently, last year, the team of Professor Sidler published a very nice paper explaining that. And what did they found was, and what they concluded was that PCV2D actually alters the T cell maturation in thymus in pre-immunocompetent pigs. So in the prenatal or early postnatal phase of life, certainly before the vaccination or massive infection. And so this altered T cell function means in the thymus, in this central immune system, means that this alteration of the T cell maturation can lead up to tolerance. So that finally the pig does not recognize PCV2 as non-self. So it can recognize the virus as itself. So it doesn't activate the immune responses actively to expel the virus. And so what they concluded was that most probably there is no difference in different genotypes in terms of their virulence, the potency to damage the tissues, but this ability to induce higher or lower tolerance stands behind the final expression of the PCV2 infections later in the age of pigs and the expression of the disease or not, which is, of course, interesting scientifically, and which also means that probably we should pay attention to those very early, even prenatal or early postnatal infections of piglets. Now, what is the recent classification or current classification of the diseases related to PCV2? Firstly, the subclinical infections, and then different types of clinical diseases such as systemic disease, previously denominated at PMWS, specific lung disease, enteric disease, reproductive disease, and PDNS. So the topic of today is PRDC and, of course, lung diseases. So let's talk about the relationship between PCV2 and lungs. Here on this slide, we see the probability or the ratio of confirmed PCV2 caused diseases. And so we see that most dominantly PCV2 is involved, really confirmed, in respiratory complex. So here we see four syndromes: PCV2 systemic disease, upper left, then upper right, respiratory diseases, lower left, PDNS, and reproductive disease, lower right. So this is the distribution of PCV2 confirmed diagnosis in Iowa State University in a couple of years. And so again, we see that most probably PCV2, or most frequently PCV2, was confirmed, especially in the respiratory disease complex. So the involvement of PCV2 as a confirmed agent is really high in respiratory diseases. On this slide, this is another confirmation of the role of PCV2 in respiratory diseases. This was the study made in Austria, and the team was comparing different setting, such as the type of farms, farrow to finish compared to just pure fattening pigs, and then vaccinated, PCV2 vaccinated versus non-vaccinated pigs. And they studied the relationship between the type of farm and PCV2 vaccination versus the presence, frequency of pneumonia in dead pigs and in slaughter pigs. And they have found the highest probability of having no pneumonia or no lesions in slaughter pigs in pigs from fattening farms and PCV2 vaccinated. The probability was 50% compared to those coming from farrow to finish farms and PCV2 non-vaccinated. So at the end, as a conclusion, we can see that PCV2 vaccination can really significantly decrease the frequency of pneumonia in slaughter pigs. So the involvement of PCV2 in the respiratory syndrome is confirmed very high, and PCV2 vaccination can significantly decrease the probability of pneumonia. Now, specifically, what PCV2, how does PCV2 affect lungs? So this kind of mono-infection of PCV2, as described previously, can lead to PCV2 lung disease. The clinical expression is obvious: respiratory distress, dyspnea. In necropsy, we can see bronchointerstitial pneumonia, and on histology and by the confirmation of PCV2 in staining, we can see high amount of PCV2 antigen in lungs and negative or low in the lymphoid tissue. So this is how the lungs look like having the PCV2 lung disease. So we can see the congestion, hyperemia up to bleeding, and interstitial pneumonia with edematous interstitial interlobular spaces. On histology, we can see again interstitial pneumonia with a huge amount of lymphocyte infiltration around the bronchiole and bronchi. The diagnostic criteria, according to Segales from 2012, is first the presence of the clinical disease, so respiratory clinical signs, interstitial or bronchointerstitial pneumonia with mild to severe necrotizing, and the absence of the lesions in lymphoid tissue, because if there are lesions in the lymph node tissue, then it is classified as systemic disease. The same for the confirmation of PCV2. It has to be confirmed in the lung parenchyma, and it should not, or very low in the lymphoid tissue. Otherwise, it would be classified as PCV2SD. One a bit specific syndrome was described in 2010 in the United States, and it was named as acute pulmonary edema. The syndrome which affects the nursery and young fattening pigs with high mortality, up to 20%, with a very acute disease. And it was found that this pulmonary edema affected pigs with very low, up to absent antibodies against PCV2. The picture and necropsy, we can see the edema in lungs, a lot of serous up to bloody fluid in the thoracic cavity. On the cross-section, the histology, interstitial infiltration of macrophages and lymphocytes, pulmonary edema, and of course the confirmation, the presence of PCV2 antigen in the affected lungs. That was published on and present on dozens of farms. Since that time, we didn't hear much about this syndrome. So is it just temporary syndrome affected some of the farms? It's good to know about it, but it's not certainly not the frequent disease that we hear about. Now let's focus on PRDC. So we do know that PRDC is multifactorial disease where many factors, environmental, infectious, herd size, population size, genetics also of the pigs may play a role. In terms of the agents, PRDC is polymicrobial infection resulting from the infection from both viruses and bacteria. Most frequent pathogens involved are PCV2, PRRS, and Mycoplasma as the main agents involved in PRDC. This is a very nice summary of what's happening in PRDC, summarized by Professor Priesnik, and this is really nicely showing what happens if we have mild monoagent infections, what we see on the left side, virus or bacteria, with a low rate of multiplication, no complications, and we can see clinically mild transient respiratory disease tending to healing. However, if more agents affect the animal together, we can see, and this is divided into different actions that happen. So first of all, the direct damage of the tissue by influenza, PRRS, pseudorabies virus, MHIO, etc. The damage of the mucociliary apparatus and parenchyma. Besides that, some of the agents can really interact with the immune system, and some of them can induce the general immunosuppression, such as PCV2, PRRS, or pseudorabies virus. Some of them can induce and alter different cytokine responses, so the signaling of the immune system, Mycoplasma, PRRS, influenza, PCV2. Some of them specifically alter the function of lung macrophages, such as Mycoplasma, PRRS, or PCV2. And all those interactions can then facilitate, with the immune system, can facilitate the presence, replication of the other agents, and together, some of them can induce even the pathological lesions. Some of them, like the overreaction of the immune system, the overproduction of certain cytokines, can really lead to the inflammation lesions and pneumonia in lungs. And so altogether, it leads to the development of the complicated pneumonia and chronic respiratory syndrome with high morbidity up to 70% and high mortality. Let's talk about the interactions between different pathogens, specifically for this presentation with PCV2. Some of them really potentiate each other, and it was nicely described, first of all, for Mycoplasma by Wang and his colleagues, that Mycoplasma co-infection, this was the in vitro study, Mycoplasma co-infection with PCV2 in the tissue culture, some Mycoplasma strains can enhance the replication rate of PCV2. And this was really like Mycoplasma strain specific. So some of them could increase the replication of PCV2 up to more than 350%. So the co-infection of Mycoplasma together with PCV can really make more severe the PCV2 infection. Besides that, we do know that Mycoplasma induces on one side the strong pro-inflammatory reaction. It induces the production of pro-inflammatory cytokines. On the other hand, it can also suppress the activity of alveolar macrophages, etc. And so it can potentiate the expression of pneumonia due to PCV2 or PRRS. And even in the kind of dual infection models, it was confirmed that vaccination, so the control of Mycoplasma due to vaccination, can decrease the lesions due to PRRS, for example. Now, the co-infection of PCV2 and PRRS, it was found that PRRS can induce, again, high replication of PCV2. So the dual infection of PCV2 and PRRS can result in the higher viral load of PCV2, and not, interestingly, vice versa. So on the upper right chart, we can see higher viral loads of PCV2 in those dual infections of either PCV2A or PCV2B and different types, type 1 or type 2 PRRS. However, on the lower right chart, we see no interaction, no potentiation of PRRS viral loads due to PCV2. Those differences are only between different types of PRRS, okay, type 1 and type 2. So again, PRRS infection can increase the replication of PCV2. And as a result, here we can see the lung tissue lung tissue damages. So the different levels of the lung scores in dually infected pigs. If we can see on the chart those first 4 bars 14 days after the infection and first 4 bars 28 days after the infection, those bars express the higher lung scores compared to in the dual infections compared to the 4 other bars, which express the lung scores in mono PCV2 or PRRS infections. The only higher mono infection score was due to type 2 PRRS infection. However, even in this case, the co-infection with PCV2 induced higher damage of the lungs. Interestingly, porcine parvovirus was also found as the important co-infector of lungs. This is the results of this study in the United States, and we see that relatively high frequency of both infectious agents was found in pneumonia in pigs, up to 13%, specifically of parvovirus type 2, less parvovirus type 3 and parvovirus type 4. Anyway, all of them we have present in Europe. And it was concluded that PCV2, parvovirus type 2, and parvovirus type 4 were significantly associated with lung pathologies. So there was found also synergistic effect between PPV and PCV2. It was concluded that there is no like real synergy between PCV2 and swine influenza. Of course, it was present before. Influenza is an important lung pathogen, and of course they can be present together as co-infectors with PCV2. However, seemingly there is no real interaction between those two. So as a conclusion for those interactions, there was the synergistic effect found between PERS, Mycoplasma, and pivovirus, but not with SIV, synergistic with PCV2. I have mentioned already a few times the importance of the immune responses, the importance of the interaction between the pathogen and the immune system. PCV2 is known to induce inflammation. At the same time, PCV is known to induce immunosuppression. So the interaction between PCV2 and the immune system is quite complex and quite complicated. This is a little bit an effort to simplify the interactions on this slide, published by Sommerfield and others. And we can see that PCV2 can really lead to a strong, important kind of down regulation of the immune responses and even up to tolerance. PCV2 can infect the natural interferon producing cells, which are very important, probably most important cells in the control, in the fight against the viral infections. They are known to produce different cytokines, especially interferon alpha, IL-6 and others, which are important in the control of viruses, which are important in the signaling pathway for the maturation of the other effector cells. And so PCV2 can alter the function of those cells. And so then the other cells are unable to distinguish between PCV2 and self-antigens. And so finally, PCV2, as I was mentioned before, can be considered as self-item. And so this can lead up to tolerance, and PCV can persist and can circulate a long time in the body with no reaction of the immune system. PCV2 is also known to induce the strong interleukin-10 production by macrophages, dendritic cells. IL-2 is one of the most important immunosuppressive cytokines, really decreasing the expression of the other inflammatory cytokines, maturation of the cells, etc. So those together can lead to the strong immunosuppression. At the same time, PCV can induce also the production of the inflammatory cytokines, and what we have seen also in the case of lungs, it can induce the inflammation and pneumonia, the accumulation, infiltration of specifically mononuclear cell lines in the lungs. So again, the interaction with the immune system is quite complex. What is important for the PRDC is especially its immunosuppressive activity function, which facilitates the expression of the other pathogens. This is the demonstration of the strong IL-10 production, either in the single mono infection of PCV2 or together with pseudorabies virus. So as a conclusion, due to the interaction between PCV2 and the immune system and the immune system, both innate, so this first non-specific, and adapted specific immune responses can be altered, which can lead to the subclinical or clinical diseases. And the anti-PCV2 vaccination can therefore also to help to control the other infections and can be the first important element in the control of PRDC. When I mentioned the subclinical infections, we do know that those are even more important in the swine industry than the clinical diseases due to PCV2. And it was calculated and evaluated a couple of years ago that really this the impact of these subclinical infections, which on this chart is shown in this green line, is higher than the economic losses due to PCV2 systemic disease, which is this dotted red line. So the control of specific, especially those subclinical infections, is crucial in maintaining the economic profit of the farms. Now, what to do with PCV2 and in relationship to PRDC? What are the solutions? So we have seen that in PRDC, the probably most important pathogens which even interact with each other are Mycoplasma, hyopneumoniae, PRRS, and PCV2. So the most important thing is to, of course, control those infections, to perform the relevant diagnosis and identifying the other co-infectors. And because PRDC, as we mentioned at the beginning, is really multifactorial, also we have to pay, of course, the attention to the environmental management and other factors. What SIVA can help also to PRDC, first of all, by the control of Mycoplasma hyopneumoniae. You probably know Hyogen as the inactivated MHIO vaccine. And I would like just to share with you the results, the recent results, which were now published at ESPHM. The results of Spain, where we collected the data on a huge number of pigs, huge number of lungs, more than 250,000 of lungs were scored using SIVA lung program, which is the methodology for the assessment of the EP-like lesions in slaughter pigs. And so in 3 years, this huge amount of lungs was scored, and here we presented, or our colleagues presented the results of the farms where also they had the record of the vaccine which was used. And so they just made the distribution of the farms and the batches vaccinated with different vaccines and the corresponding prevalence of EP-like lesions and the extension of the lesions. And so you can see that Hyogen vaccinated pigs had statistically less EP-like lesions, and also the extension of the lesion, the severity of those lesions was statistically significantly lower compared to other either two-shot vaccines or other single-shot or combined PCV2 MHIO vaccines, or compared to non-vaccinated compared to non-vaccinated pigs. So in this on this list, we can see really that Hyogen outperformed the other vaccination strategies, whatever one or two shots, and appeared to be the most efficient in controlling MHIO infections and enzootic pneumonia. So this is what this is the way how do we propose to control Mycoplasma. In terms of PCV2, I'm sure you're familiar with Circovac as the inactivated PCV2 vaccine. We have mentioned the PCV2D as the most prevalent genotype in in clinical disease pigs or clinically affected farms. So of course, any efficient vaccine against PCV2 should have confirmed efficiency against PCV2 different genotypes. So this is just for an illustration, the results of the experimental challenge trial with PCV2D as the experimental infection. And so we also made the comparison with the other vaccines. So we just can see that Circovac is highly efficient in reducing viremia below the important levels, let's say, and also in reducing the amount of PCV2 finally in the lymphoid tissue in euthanized pigs. So this is just the demonstration of the high efficacy of Circovac against PCV2D genotype. Thanks to the possibility also to set up the let's say flexible vaccination strategy. Due to the possibility of using Circovac for the vaccination of sows and for the vaccination of pigs, it is possible really to set up the most efficient strategy at different epidemiological condition. As an example, I would like to use this study made just by coincidence also in Spain. It was an interesting situation when on the farm where Circovac was used also to control PCV2 infections in nursery pig and fattening pigs. There was a problem with the early PRRS infections early after weaning, early after in nursery. And so the idea was to avoid the interaction between those early PRRS infections and circovirus vaccination, to postpone the Circovac vaccination to the later age. And so how to cover the potential window for the early PCV2 infection, it was decided to vaccinate the sows before farrowing to induce higher protection, higher defense in the early post-weaning pigs. So, and then finally they compared the production parameters in those two groups. So one group, pigs vaccinated with Circovac at 4 weeks of age. The other group, sows vaccinated with Circovac before farrowing, and pigs vaccinated with Circovac at 10 weeks of age. Again, to avoid the coincidence between early PRRS circulation and PCV2 vaccination. And so what we could see was really the improvement in mortality. Mortality rate was reduced by more than 2%. Higher weight gain in this group 2, that means vaccinated sows before farrowing and pigs vaccinated at 10 weeks of age, and also the feed efficiency was higher. So this is really just the example that if we have the trouble with the, for example, early PRRS infections, it is possible to modify the vaccination strategy against PCV2 using both sow and piglet vaccination. So as a conclusion to this presentation, we do know that PCV2 is the worldwide present pathogen, one of the, if not the most important pathogen in swine, which is evolving. We have more and more genotypes identified, and I'm sure that we will see more and more types of PCV and more genotypes of PCV2. Number one. Number two, PRDC involves a large number of microorganisms, and this, of course, makes the diagnostic approaches and the control approaches complicated. However, PCV2 is one certainly of the most important pathogens involved in either directly development of pneumonia or contributing to other pathogens due to the immunomodulation of the host responses. PRDC certainly needs predominantly to control PERS, MHIO, and PCV2 infections. Those three can really interact among each other, and those are the probably most important in the respiratory complex. And so at this stage, I would like to thank you for your attention. And if you would later have any questions, I'd be happy to answer. Thank you.
Mille grazie, Roman. Grazie davvero per questa presentazione. Credo che anche in questo caso abbiamo chiarito alcune cose, soprattutto relativamente al comportamento di uno dei patogeni più importanti con i quali ci siamo confrontati negli ultimi anni e che tanto ha determinato le sorti dell'allevamento suinicolo industriale nel mondo moderno, visto che il PCD è comunque riconosciuto come una delle cause principali di danni anche economici, appunto, a livello di allevamento industriale. Senza togliere altro tempo, passerei innanzitutto alla lettura della domanda che ha fatto Chiara Longhi, la nostra collega, che è diretta ad Enric Mateu. So che ce ne sono altre che ha raccolto Emanuela, per cui dopo chiederò la sua collaborazione per poter illustrare quelle successive. Quindi per Enric si chiedeva qualche informazione sull'influenza di tipo D rispetto a quella di tipo A e la sua importanza clinica nell'allevamento suino.
Well, influenza D has been reported very recently, and as a matter of fact, there is a recent paper, I think 2019, about influenza D in Italy. And I'm talking by heart, so maybe the figures are not exactly like that, but I remember that it was about 10% of positivity of antibodies in the swine health examined. In France, they also examine about influenza D. In the results from France, the prevalence was higher in bovine compared to swine. But we're talking about these levels, 5, 6, 7, 10, 15% of seropositivity. The problem up to now is that there is no clear link between influenza D and clear clinical disease in the animals. And most of the reports suggest that could be something like influenza C in humans or influenza B in humans. I mean, the virus can infect the pig, the virus can produce some clinical disease, but a lower level compared to influenza A. The data are very scarce up to now. We have been looking for influenza D in Spain, and my results at present are zero. No, none of the farms that I examined were positive.
Ok, mille grazie Enric. Emanuela, cedo la parola a te perché so che hai raccolto alcune domande per i nostri relatori.
Sì, ho alcune domande che mi ha fatto in via separata e altre. Una, per esempio, è mia invece, ed è per il professor Maes. E probabilmente mi sono persa sulla parte del diagnostico, appunto, per Mycoplasma. Volevo capire, la PCR fatta in vivo è un sistema comunque che consideri utile come appunto sistema diagnostico della malattia in vivo, o in realtà è un qualcosa che consiglieresti di utilizzare, diciamo, unicamente in quei casi in cui si voglia eradicare, per esempio, la malattia da un allevamento?
I think the question is related to the fact to confirm freedom of infection in a farm on the one hand, and on the other hand, assess the importance of M. hyo or other pathogens in a clinical outbreak, which are indeed two different items. In the first case, I will definitely use, or if there is doubt, I will definitely use PCR testing on tracheal swabs or bronchus alveolar lavage fluid. In terms of assessing the presence or the importance of Mycoplasma hyopneumoniae in a clinical outbreak, PCR can definitely also be helpful to see whether Mycoplasma is present, but of course it's also important to assess the lesions and to evaluate the clinical problems. So in both circumstances, I would say yes, PCR can be used, definitely to confirm freedom of infection, and also in clinical outbreaks, you can easily detect M. hyo in the lesions. But also, it's not because you suspect a farm with clinical signs resembling enzootic pneumonia or PRDC that you should only test M. hyo or only test PCV2 or only test influenza, because we know that most of the outbreaks that more than one pathogen is involved. You can have single outbreaks, but in the majority of the cases, you mostly have more than one. So from that point of view, it's also interesting to assess the presence of M. hyo together with other pathogens.
Thank you.
I would not say that serology is not needed anymore, and that's not useful. Even in farms that are free, if you have a stable situation, you don't see clinical problems, you don't have evidence of more lesions, and your serological sampling of a sample of animals consistently shows negative results, well, then I don't think that there is a need to use PCR. But if you have a few serological positives or doubtful results, or if there are other signs that can be very discrete that point to a possible infection with M. hyo, then to be sure, I would recommend to use PCR.
Thank you very much. I have another question for you, Dominik. Scusa, in italiano, mi sono confusa. Un'altra domanda.
Nessun problema.
Un'altra domanda sempre per te. Allora, in questo caso, riguardo le misure di controllo, sempre per il Mycoplasma, volevo capire, ci sono delle categorie di parto più a rischio, cioè ci sono, non lo so, c'è un maggiore rischio per la trasmissione da parte delle scrofette, come succede con altre malattie, oppure sono le scrofe più anziane, per esempio quelle a rappresentare un reservoir magari dell'infezione in azienda? E per quanto riguarda le scrofette, faccio due domande assieme, quale sarebbe il migliore programma vaccinale, diciamo così, secondo la tua esperienza per appunto questa categoria particolare di animali?
Yeah, good question. Actually, yeah, good question. So definitely different studies have shown that there might be a parity effect. So in general, younger sows are more likely to be infected and more likely to transmit the pathogen to the offspring. This does not say that older sows cannot do so, but on average, yes, younger sows, primipara sows and first or second parity sows are more likely to transmit the pathogen to the offspring. And as Henrik also mentioned in his presentation, one of the differences in older farms and newer farms is that in our new farms, we have a high turnover of sows. In many farms, we have 50, 55%, sometimes 60% of the sows that are replaced each year, meaning that we have a large proportion of the sow population that are young sows and that are higher risk. Whereas in the past, if we have only 35 or 40% replacement rate of sows, your proportion of young sows in the farm and in the sow population is lower. So knowing that, what are the control measures that we can do? Well, we recommend to vaccinate the young sows in case the farms purchase breeding gilts from another breeding farm. They should be placed in a quarantine, and then we recommend to apply a vaccination. And in most of the farms that works. However, we see also in some farms that you might be clinical problems, more pronounced or less pronounced. Sometimes a few coughing or some sows with fever. And in that case, it is still possible that Mycoplasma hyopneumoniae, for some reasons, has entered the breeding population and causes problems there. And in that case, we recommend to apply, to vaccinate all the sows at once in the farm, one time or 2 times, and usually that stabilizes the situation. And yeah, most farms then continue with vaccination in a quarantine unit without continuing sow vaccination. I know that some farms then say, or veterinarians recommend, well, not to take any risk. We will vaccinate the sow, group vaccination in the sows once per year. Could be possible, but then I say that yeah, if you vaccinate, or sometimes they vaccinate the sows at the end of gestation. It's also a possibility, but I think that's applied less or practiced less. But in case you vaccinate the sows also during late gestation, I would not recommend then to vaccinate the piglets with the same vaccine in the first week of life. So then because at least with some vaccines also you can have a high serological response and a high level of maternal antibodies. There I would recommend then to postpone a little bit the vaccination of the piglets. I know there is not clear-cut evidence about the influence of maternal antibodies on piglet vaccination. There has been some studies and some show an inhibition of the protective effect. Some show an inhibition of the serological response upon vaccination of piglets, and some studies do not show any effect of piglet vaccination. So that's quite variable.
Ok, thank you very much. Thank you, Dominic. Continuo io con le domande, se non si...
Sì, direi assolutamente. Non si è aggiunto nessuno al momento, no, per cui possiamo continuare con quelle arrivate nel frattempo.
Allora, ok, la prossima domanda la faccio più in ordine di relatori, quindi è diretta principalmente ad Enric, e riguarda il discorso della reattività crociata nel test dell'HI, ma in realtà vado ben oltre questo discorso, nel senso che volevo capire, vaccinare ripetutamente, supponiamo le scrofe per esempio, no? Sappiamo che alcuni programmi vaccinali prevedono 2 vaccinazioni per esempio l'anno, però a livello pratico spesso si riscontrano dei benefici incrementando il numero di vaccinazioni, magari 3 volte l'anno. Volevo chiedere, c'è effettivamente come possiamo dire, con la vaccinazione ripetuta, che risultati possiamo ottenere? Cioè, possiamo incrementare il livello di immunità, per esempio, della popolazione oppure no? Nel senso dell'estensione anche dell'immunità verso diversi ceppi.
This is a very complex question. If the point is whether by repeating vaccination we can increase the titers, the answer is yes. I mean, if you administer the vaccine up to, let's say, 3 or 4, 5 or 4 times per year, you can see that the titers are increasing. A very different point is the meaning of this increase. And even a more complex thing is whether this increase is increasing the breadth of these antibodies. And you have to consider several things here. The first one is that the most common test that we use for testing the increase in the antibodies or the presence of antibodies in influenza is the hemagglutination inhibition. This test has some correlation with the neutralizing activity of the serum, but this is not a full correlate. I mean, it's very well known that the hemagglutination inhibition is just detecting antibodies that are raised against what's called the globular head of the hemagglutinins, the most outer part of the hemagglutinins. But the antibodies that produce a broadly neutralizing activity are not directed there, but are directed to the stem of the hemagglutinins, to the place where the hemagglutinins combines with the matrix protein. So, first point, you can detect an increase in the titers by repeated vaccination, and this suggests that you have increasing immunity against your homologous strain, but this tells very little again the heterologous strains that you can face. The second thing that you have to consider is that within a lineage, you can have a lot of variants with different reactivity, and this reactivity is not completely symmetric. I mean, if you immunize one animal with strain A, and then you test strain B and do the opposite, immunize with B and test strain A, the results not necessarily are the same. So you cannot know that. And the third point is that the neutralizing, the real determination of the neutralizing antibodies by the viral neutralization test is a test that is not very well standardized. So the short answer is, okay, if you are vaccinating 3 times per year, probably you have higher immunity than if you are vaccinating 2 times per year. The long answer is, okay, that's right, but this says nothing about how good is this increase in the immunity for saving you of the problems that are created by that. And then you can have another thing that is really interesting. I mean, when you look at the farm in which the immunity is, let's say, and I beg your pardon for using this term, normal, and by normal I mean that more or less you are in the middle of the range of the things that of the antibody titers that you can find in the farms. Usually what happens is that animals are being infected drop by drop. Some animals have, I mean, in the nurseries, some animals are in the lower part of the distribution, so they are infected first, and some other animals are infected then, and so on. So you are distributing the cases. When you raise a very high level of immunity in the cells, one side effect is that most of your animals reach a very high level that shift the infection to older ages. I mean, instead of this slow disappearing of the maternally derived antibodies, then you have a sudden loss of the maternal immunity around 8 or 9 weeks of age, and then all the animals are infected to tones. So for me, that's a very complex question. And one thing that we tried, just to give you some additional information, was to in the lab to immunize animals with different strains, just to see, okay, if I take SIVA vaccine and I combine SIVA vaccine with Kipra's vaccine and so on, I do repeated vaccination using different type of vaccines. Do I increase the panel of strains that I can block? The answer is yes, but it's yes in the long term, not in the short term. So again, I don't know if it's very feasible or very practical in the farm to go beyond 2 vaccinations per year.
Okay. Thank you very much. Very complex. Thank you.
Molte grazie Enrique. Stavo notando che il tempo vola quando ci si diverte, e siccome mi auguro che anche voi vi siate divertiti, lo spero sinceramente, direi facciamo l'ultima domanda, Emanuela, poi c'è un contributo nostro e poi possiamo definire chiusi i lavori per la giornata. Prego.
Grazie. Allora, l'ultima domanda invece ovviamente tocca a Roma. In realtà ne avevo diverse, però visto i tempi sono costretta a farne soltanto una. Volevamo capire, una domanda che mi è stata fatta è quale sarebbe il sistema diagnostico, diciamo, migliore, per esempio, per valutare, più che altro per diagnosticare l'infezione subclinica da suecovirus.
Okay. Yep. Yes. Thank you for the question, and thank you for the translation. So, how can we diagnose the subclinical infections? Basically, the the result of the subclinical infection is usually the decrease of the performance. So number one, the performance parameters have to be evaluated and compared to, I will use Enrique expression, I beg your pardon, but to normal conditions. So as, let's say, to the standard long-term conditions. So performance parameters, number one. Number two, the presence of the virus. Of course, it has to be present. It has to be present in certain categories of pigs. So now it depends if we talk about the subclinical infections of the breeding animals or piglets of which age. And there have been even some cutoffs how to discriminate between negative, subclinical, and clinical infections based on the different amount of PCV2 virus present in the blood or in the tissues. And of course, when we do the in vivo diagnosis, then we can do the blood. However, those cutoffs were very valid at the initial years of PCV2 circulation before the herds were vaccinated. It seems more and more that those cutoffs in currently vaccinated herds and in currently different genotypes present do not really correlate with with those categories, subclinical or clinical infections, and we can have herds with very high, 8 logs, 9 logs levels of viremia, and the pigs are clinically healthy. So yes, they have the subclinical infection, but according to those high levels of viremias, they should be clinically ill, or the batch or the population should be clinically ill, but it doesn't. But it isn't. So those cutoffs are really maybe indicative, but they do not express all the time the clinical relevance. So I would say, yes, the confirmation of the virus and the performance criteria, the performance parameters.
Okay, thank you very much, Roman. Thank you.
Passiamo all'ultimissima parte della relazione, poi salutiamo tutte le persone che ci hanno accompagnato fino a qua, inclusi ovviamente i nostri colleghi che si sono prestati per le presentazioni di oggi. A te, Manu.
Bene, un brevissimo contributo della CEVA. Sorry, just one second, because I have deactivated.
Era a posto, Emanuela, rimetti com'era.
Sorry, one second.
Oh, sorry.
Ok. Ok. Could you see the presentation? Potete vedere la presentazione? Scusate, ma avevo disattivato l'audio per sbaglio. Mi sentite?
Sì, a posto.
Ok, e niente, brevemente un piccolissimo contributo CEVA. Prima di tutto, come ha già fatto Paolo, ringraziare i nostri relatori per insomma tutte le conoscenze che hanno condiviso con noi, appunto riguardo al complesso respiratorio suino e in particolar modo il Mycoplasma, l'influenza, il circovirus. Abbiamo visto che appunto si tratta di una patologia che ha un impatto economico veramente proprio dovuto alla patogenicità di Mycoplasma, influenza, circovirus per sé, ma soprattutto perché esiste appunto un effetto sinergico tra questi patogeni. Ovviamente la CEVA, il nostro ruolo come azienda, in questo caso il nostro obiettivo è quello di aiutare, possiamo dire, voi colleghi veterinari e gli allevatori a cercare di ridurre il più possibile appunto l'impatto di questa patologia, e ovviamente il nostro impegno nei vostri confronti è su due fronti: da una parte abbiamo ovviamente una serie di prodotti, mettiamo così, di soluzioni, più che di prodotti, poi parlare di soluzioni per il controllo della patologia. Stiamo parlando in particolar modo della linea biologici, e per quanto riguarda appunto il complesso respiratorio suino posso dire che la nostra azienda fortunatamente ha un range di vaccini veramente completo, quindi verso tutti i patogeni che abbiamo visto fino adesso, quindi l'Iogen per il Mycoplasma hyopneumoniae, Coglapix per l'APP, il Respipork Flu 3 e Flupan, che sono rispettivamente per la protezione dai ceppi influenza classici e quello pandemico, ancora il Progressis, il Circovac per appunto le patologie associate alla PIRS e al circovirus rispettivamente. Per quanto riguarda le attività e i servizi, sapete che appunto, di solito lavoriamo con voi sul campo, però in particolar modo per quello che si riferisce al complesso respiratorio suino, ci terrei semplicemente a ricordarvi alcuni dei nostri servizi, che sono appunto il Sevalang Program, il progetto del Vaccinomics, la nostra Flu Survey e ultimo, non ne parlerò adesso per una questione di tempistiche, anche perché non era un obiettivo, diciamo, uno scopo del contesto di questo congresso, anche una particolare survey per quanto riguarda la determinazione dei seriotipi della PP utilizzando un sistema diverso rispetto a quello classico, utilizzando quindi una PCR. Questo è un lavoro che stiamo facendo in collaborazione con l'Imperial College di Londra e anche con l'Istituto Zooprofilattico di Parma. Per quanto riguarda il Sevalang Program, parte del già accennato Roman, è una metodologia, sono delle linee guida per valutare correttamente e soprattutto in modo oggettivo quello che è la presenza, l'incidenza, ma soprattutto l'impatto delle infezioni dovute al Mycoplasma hyopneumoniae e l'actinobacillo peropneumonia, ovviamente nel contesto della malattia respiratoria del suino. Sicuramente molti di voi conoscono e abbiamo già collaborato assieme per quanto riguarda il Sevalang Program. Uno dei punti cardine di questo programma ovviamente è la punteggiatura polmonare al macello per la valutazione delle lesioni riferibili appunto alla broncopolmonite, quindi alla polmonite zootica e alla pleropolmonite suina. Posso dire con orgoglio che insomma abbiamo secondo me raggiunto una certa expertise in questo settore, perché lo dicono i numeri, nel senso, se considerate dal 2018 ad adesso il nostro team ha diciamo, esaminato ben più di 35.000 polmoni provenienti da più di 280 aziende, quindi abbiamo una casistica veramente dico, significativa. Una delle cose poi che offre questo programma è il poter realizzare ovviamente le punteggiature con un'app dedicata, ma soprattutto la possibilità di ottenere in tempo reale dei dati e delle statistiche che possono essere molto utili all'allevatore, per esempio per capire anche qual è l'impatto delle misure di controllo che vengono applicate nei confronti di questi patogeni, per esempio l'impatto che può avere la scelta di un determinato programma vaccinale rispetto a un altro in una determinata azienda. E tutti questi dati, appunto, dicevo, ci vengono forniti in modo automatico dalla app, quindi potreste vedere, per esempio, supponiamo di avere diversi ingrassi che appartengono a una stessa azienda, possiamo vedere, per esempio, quale di questi allevamenti funziona meglio, quale peggio, e rispetto, per esempio, al Mycoplasma, e vedere come intervenire in uno rispetto ad un altro. Idem, possiamo vedere la progressione dei risultati che otteniamo nel tempo, per esempio per una stessa azienda, e poi altri valori sicuramente di riferimento sono quelli del famoso indice EPI, che sarebbe appunto l'indice relativo alla polmonite zootica, e poi quello API. Una cosa importante che devo sottolineare è che il nostro sistema ti dà la possibilità di comparare, per esempio, la tua azienda con quello che è la media nazionale, e l'altra cosa importante è che la media nazionale fondamentalmente è, come si dice, è una media mobile, cioè ogni anno si sposta sulla base, lo vedete anche qui le differenze, sulla base di quelli che sono i risultati di tutta la popolazione analizzata. Quindi è uno strumento sicuramente molto utile. Un secondo accenno è sul flu survey, quindi un monitoraggio che stiamo realizzando qui su tutto il territorio nazionale, che prevede la raccolta di tamponi nasali su 3 categorie, in particolare di suinetti, quelli sotto scrofa, quelli appena svezzati, quelli a fine svezzamento magronaggio, con diversi obiettivi. Ovviamente in alcuni casi si tratta, l'obiettivo è quello di diagnosticare se una determinata patologia respiratoria è dovuta all'influenza, ma l'obiettivo di questo tipo di monitoraggio che stiamo conducendo a livello europeo è anche quello di validare un metodo di campionamento efficace, specialmente nel caso delle infezioni endemiche. Ci ha già detto il professor Matteo, per esempio, che la sierologia, in particolare il test dell'HI, può dare dei risultati che sono veramente difficili da interpretare, mentre i tamponi nasali consentono un isolamento diretto del patogeno. E un altro obiettivo di questo monitoraggio è quindi in conseguenza quello di conoscere meglio l'epidemiologia dell'influenza in un allevamento e che ceppi sono coinvolti, e poi ultimo ma non meno importante quello di contribuire con i lavoratori di riferimento nazionali ed europei allo studio appunto della prevalenza dei vari ceppi nel territorio. E questo tra l'altro ci porta a un'altra parte di questo progetto, quello della Dynamic Flu Map, quindi una mappa proprio interattiva. Qua potete vedere il link, ma basta entrare nella nostra pagina web e troverete questo stesso link, per arrivare appunto a vedere come nei diversi paesi appunto europei è la situazione riguardante l'influenza. Potrete vedere ovviamente quanti ceppi sono stati isolati in ogni zona geografica, che tipo di ceppi, eccetera. Questa qua è un'immagine, una fotografia del 2020, ancora noi non avevamo iniziato a lavorare in questo progetto, già da quest'anno potrete vedere i primi risultati perché comunque vengono aggiornati trimestralmente, a breve dovrebbero esserci i primi risultati anche italiani. Finalmente, cioè per finire, Vaccinomics è un progetto molto importante per noi e penso che possa essere un servizio davvero molto importante anche per voi veterinari e per gli allevatori, che ha come obiettivo fondamentalmente quello di diffondere quelle che sono le buone pratiche di vaccinazione dei suini. E in particolar modo gli obiettivi sono due. Sappiamo che un vaccino ha delle capacità, però per esprimere al 100% queste sua capacità, diciamo così, sono fondamentali due fattori. Da un lato il corretto posizionamento della vaccinazione, perché ovviamente la vaccinazione deve essere fatta quando serve, è una cosa importante. Il tipico esempio è quello di fare la profilazione sierologica per stabilire quando termina appunto l'immunità materna e inizia invece l'infezione attiva di campo, come nel caso per esempio del circovirus o del latinobacillo pleuropneumonia. L'altro pilastro su cui si basa il Vaccinomics tramite una serie di audit, di visite in azienda, una checklist molto completa, eccetera, si tratta proprio di stabilire la qualità della vaccinazione, perché ovviamente maggiore la qualità della vaccinazione, maggiore il beneficio per l'allevamento. E semplicemente questo è tutto, spero sapete bene o male, questi sono un po' i progetti che abbiamo in marcia adesso per quanto riguarda la parte delle patologie respiratorie. Ovviamente ne approfitto per invitarvi a collaborare con noi in questa serie di progetti. Sapete insomma chi contattare, me o il dottor Cominotti del servizio tecnico, e siamo qua a disposizione. Questo è tutto e vi ringrazio per l'attenzione durante tutto il congresso. Grazie mille.
Grazie Emanuela. Io ne approfitto per ringraziare nuovamente i relatori della loro presenza e della loro disponibilità. Spero che l'incontro di oggi sia piaciuto e abbia fatto nascere dei motivi e degli spunti di interesse per tutti i partecipanti, per cui non mi rimane altro che ringraziare anche il supporto che ci è stato dato per organizzare l'incontro, il servizio di traduzione ovviamente e tutte le persone che hanno assistito, e auguro a tutti buona serata intanto.